Good afternoon, and welcome to the National Baptist Convention USA Incorporated Hope Health Initiative webinar, Coronavirus and the Church. I'm your host for today's presentation, Michael Miner. I am the National Director of the Hope Health Initiative. We bring you greetings today on behalf of our President, Dr. Jerry Young. The National Baptist Convention USA Incorporated is the nation's largest African-American denomination with over 8.5 million members and 35,000 churches. We also acknowledge our General Secretary, Dr. Alvin Edwards, the chair of our federal faith-based initiative, Dr. Alvin Love, and of course, to all the cabinet, Dr. Young's cabinet, our regional vice presidents, our many churches, and all of you that make up the body of the National Baptist Convention USA Incorporated. We also greet everyone who's watching us through our webpage, www.hopenbc.com, and on our Facebook page. We're also thankful for those who've joined us by Zoom. Unfortunately, we'll be only be able to take questions from those participating by Zoom. But if you have questions from our Facebook page or our YouTube presentation, you can email us at info@hopenbc.com. That's info, I-N-F-O, at hopenbc.com, and we'll be sure to respond to your question. We're excited about today's webinar, and we want to provide an overview now of what we'll cover. We want to reflect on what was the time of our church before the pandemic. We want to talk about adjusting to the new normal, and the impact of the coronavirus, our response to the virus, how are we going to learn to love from a distance, preparing for a new normal, and if we have time, we'll share some things about the NIH's All of Us research program. Now it gives me a distinct honor to introduce our panelists. So I'm going to bring up on the screen just momentarily while we get ready to get things going. All right, our esteemed panelist, Dr. Lavoro Williams. Let me say a few things about her. She's an associate professor, University of Kentucky School of Nursing. We know you've seen her bio when you registered for the webinar. She is recently joined the College of Nursing there. Prior to joining the University of Kentucky, she was a tenured associate professor and director of diversity in the College of Nursing at Augusta University, there in Augusta, Georgia. She has countless accomplishments, and we're proud to have her as the director of our research arm of our Hope Health Initiative. And most importantly, we're excited that she is a child of the King.
Amen.
And of course, I am your other panelist, and also will be your host today. And I am pleased not only to be the National Director of the Hope Health Initiative, but I am excited to share that I am the pastor of the Hill Hernando Baptist Church in Hernando, Mississippi. As we always say, we are a fellowship of believers dedicated to service after benediction. I also serve as the president of the Mid-South Churches Baptist State Convention, an affiliate of the National Baptist Convention USA Incorporated. And I'm pleased to say, in this time like these, I'm excited and pleased to say that I am a child of the King as well. All right, everybody, as they say, let's get it on. All right. And again, if you have any questions as we move forward today, you can make so in the chat box. So, Dr. Williams, they say, are you ready to rumble?
Yes, sir.
All right, let's get started. Well, and of course, we have posted Dr. Williams' op-ed on our webpage, hopenbc.com. It was just posted a few minutes ago, and we're glad, as the singer say, for the world premiere, but we're excited about the world premiere of her op-ed. So, Dr. Williams, I'm reading your op-ed, and wow, it was awesome. And I'm reading a piece, the first part, it says, last Sunday, as I sat in my living room preparing to join my church's live stream worship, I reflected on how just 5 short weeks ago, I was able to worship with my church family. I miss corporate worship, the warm hugs, friendly faces, handshakes, and serving. I asked myself, when will things return to normal so that I can attend church again? So I have this question. After the initial shock and upon further reflection, what were your thoughts? All right, and that's one of the things about doing the Zoom live, you have these technical freezes. So Dr. Williams. Dr. Williams is having some connection issues on her end. All right. Okay, she's frozen. Okay, we're gonna ask her to see if she can reboot. But she did, okay, she just booted off. All right, but guess what? She allowed, she shared a few notes with us just in case we had this issue. Dr. Williams said that she was struck by the fact that the building is not the church. You know, sometimes we get hung up on the fact that it's the building. She writes here that the church is not the building, but the people of Christ. And reflecting the fact that where 2 or 3 are gathered, he's in the midst. And I like how she lined this up. She said, although it may seem as though the world is spinning upside down to the COVID-19 coronavirus pandemic, knowing that Christ is still the same brings me peace. And we know, and look, it's all of us. We're so used to, on Sunday. My biggest thing was getting ready to go out to church and greeting everyone, getting the hugs, just the fellowship and all those things. I'm excited about going to church on Sunday. And now I have to get ready, and I will submit to you. I'm not like a lot of people. I decided I'm going to get up and get ready. I'm not wearing a suit all the time so that I can get ready for worship and everything. All right, she's back. All right. All right, Dr. Williams. Okay, you're in multiple places. Okay. So you know what? I'm gonna put you, there we go. All right, Dr. Williams. There we go. But there's a will, there's a way. So I began sharing about your thoughts about this, your reflections on that Sunday. You may continue.
Okay, so sorry for this technological issue, but I'm telling you, I miss corporate worship so much. Just the ability to see my congregants and just fellowship with them. But I'm so very thankful that although I miss the physical church, just knowing that as a child of God, that I am the church. And as much as we desire that opportunity to gather in fellowship, just knowing that as the body of Christ, that we still exist, whether we are congregating together on Sundays or not.
All right, excellent. All right, well, I'm confused a little bit. I've heard this disease, some people call it COVID-19 and some call it coronavirus. Is there a difference?
Very good question, Dr. Miner. The short answer is no, there's no difference. But to make it more clear, the actual virus that causes COVID-19 or the coronavirus is the SARS-CoV-2. And I know that's a mouthful, but a lot of times what the healthcare profession that we do is we call the disease and the virus, they have different names. For example, we know about HIV. So HIV is the virus that causes the disease, AIDS. So that's a good example of the virus and the disease.
Okay. All right. So let's pick up on that thing about the disease. This novel coronavirus is raging across the globe. In the US, it has affected nearly 1 million people and has caused nearly 60,000 deaths. How does the coronavirus compare to the flu?
Well, you know what? What's astounding is the numbers that you just gave were numbers from a couple of days ago. And that number, even today, is higher.
Hmm.
So basically, the number of deaths compared to seasonal flu, typically seasonal flu, and it varies by year, but it's usually about 30,000 people actually die from seasonal flu. Now, the challenge with COVID-19 is that we've had double the amount of deaths already, numbers still rising, and it's a pandemic. What that means is it's not just in the United States, it's all over the world.
Okay.
And as a result of that, hospitals, with it being so much at once, hospital systems are being overwhelmed by the number of patients who are coming in with COVID-19 on top of the normal sickness that people have. People are still having heart attacks. They're still suffering from cancer. And then on top of that, we're putting this high number of acute illnesses from COVID-19 on top of that healthcare system.
Okay. All right. What are some of the symptoms of the virus? And also, if I'm not mistaken, I've heard that the CDC has expanded that list even this week.
So what are the symptoms? We're learning more and more as the virus spreads, but the most common symptoms are fever, cough, and shortness of breath. And as you said, the CDC did expand, and that expansion came as a result of just looking at more data of how people are presenting. So the expanded symptoms, in addition to the fever, the cough, and shortness of breath, are body aches, chills, a new loss of a sense of taste or smell, sore throat, headache, and diarrhea. So maybe that explains the toilet paper shortage.
Okay. At least just figure that out. Yeah.
Typically, these symptoms occur within 2 to 14 days of a person being exposed to the virus.
Okay. All right. Well, I've been struck by the number of people who are asymptomatic. They have been infected, showing no signs. Is this unusual for this type of virus?
Dr. Minor, it is unusual. And one of the most concerning things about this virus is that there are some people who feel well, but they have the virus. And because they feel well, they're still interfacing with other people and they're spreading the virus unknowingly.
Wow.
And that's terrifying.
Okay.
And where some people have symptoms to the point that they become severely ill and expire, other people walk around with the virus and are completely unaware of that. In fact, New York is actually getting some data of the general population of New York. And what they found is that 1 in 5 people had the antibody for COVID-19, and they didn't even know that they had been sick with the virus.
Wow. That is something. Okay. Well, what are some of the special risk groups for this disease, and why is it so?
Well, we know that people who are over the age of 65 or so are more at risk. And that could be because once an individual has lived to that age, they typically will have some chronic medical conditions, such as diabetes, heart disease, high blood pressure. And that puts them more vulnerable to becoming severely ill from the virus.
Okay. Are there any type of chronic diseases that have been more prevalent than others?
Yes, we found that diabetes, it's one of the more common existing condition that we've seen with the virus. And as a Black American, that's very concerning because we have one of the highest rates of diabetes than any other population. And that could be an explanation as to why we are dying at a higher rate than others.
Okay. All right. Well, look, I got to share this. This really gets me. I've seen lots of young people carrying on as if nothing is going on. It's just like wonderful. Hey, it's just life's a party. So now, are people that are young and are particularly good health, they don't have to worry, right?
Wrong,
Oh, okay.
very wrong.
Okay.
And you know what, Dr. Miner, I could see why a young person would think that they may be immune to COVID-19, because when you listen to the news and you see the faces of the individuals who have died from the virus, they're usually older people. And
Okay.
we know how coronavirus has hit nursing homes and
Okay.
how we're trying to protect our elderly. But the coronavirus is no respecter of persons.
Okay.
People as young as toddler age, young adults, everyone can be infected with the virus. And it's so very unpredictable how a person will respond to it, where some continue to have no symptoms, others become very severely ill.
Wow. Okay. All right, young people. For those that are watching that, you're not invincible. It can affect you too as well. All right. Okay. And while we're doing this, we just want to launch our first poll, maybe our only poll, but we want to put this out here for people. And as we're continuing our questions for those that are on our Zoom webinar part, we wanted to see if anyone in the congregation is sick with the virus or has been. And also, if you're on our Facebook feed or on our webpage, you can do so by YouTube. Just interesting in how that has been. All right. Okay. So now let's continue here. All right. Now, I've been particularly disturbed, Dr. Williams, by the number of people of color, especially African Americans, who have died because of the virus. Matter of fact, we've lost our past vice president at large, Dr. Harry Blake. Many of our pastors and lay people in our National Baptist churches have succumbed to disease. Am I imagining things, or are Blacks being affected disproportionately?
Unfortunately, you are not imagining things. It's true. I was reading some data yesterday that indicated that Blacks comprise 31% of the COVID-19 cases.
31%. Wow.
31%, 49% of hospitalizations, and our death rates are double or triple the number that we're represented in a population. What that is, we might in our local city, for instance, I live in Lexington, Kentucky. We represent statewide 8% of the state's population.
Okay.
Yet we're dying at a rate of 24%. So that means we're double to triple the amount of deaths than others. And why is that? People might ask, why are Blacks dying at a higher rate? And that's a very complex issue, but it could be that our underlying health is poorer than others. We know historically as Black Americans that we have been marginalized. We know that we've had less access to healthcare, less access to proper nutrition, green space where we can exercise. We are more often to live in crowded environments. We are more often in positions that are essential, such as grocery store workers, bus drivers, servers at restaurants, or bartenders. And unlike others, we're not able to work from home and self-isolate. So that puts us more at risk to the virus. And I can go on and on as to why, but in general, we more often than others have poor health. And because we are Black Americans, because of systemic racism, we have not had the access to better health. that others have enjoyed.
Okay, wow. All right, let's talk about the church here for a second. I've read stories of some churches who are conducting services as usual. Things have changed. They're taking minimal precautions. They claim that they're covered by the blood of Jesus. I'm reading things out here. Well, I'm not trying to be, but I'm just reading what people say. I mean, I'm not making this stuff up. But if you were able to speak to some of these churchgoers, what would you say to them?
I would say it's true. We are covered by the blood of Jesus. However, God gave us common sense. Mm-hmm. And we know that we are becoming sicker from this virus. We're dying more from this virus. And we know, we have information that indicates that we don't know who's sick. We don't know who's the carrier of this virus. So we really cannot put our loved ones, our fellow church members at risk by congregating and high-fiving our neighbor and shaking hands. We have to protect ourselves from this deadly virus.
Okay. Well, what are some of the common sense precautions that we can take during this pandemic?
Of the things that we've heard repeatedly, number one, washing our hands with soap and water for 20 seconds, singing the birthday song a couple of times to get to that 20 seconds.
Oh, okay.
We have to do that. Avoid handshaking, hugging, and as church people, we love to show our love that way. But right now we can't do that. I would advise everyone to wear a mask when they're out in public, because we don't know if we're sick or not. So protect others by wearing that mask. Okay. And try to continue to shelter at home as much as possible and only going out for essential activities.
Okay. All right. Well, now I know I probably already know the answer, but I'm gonna lay it out because other people be watching this. Is there any truth onto the social media posts? And remember, some people, they say the social media if it's on Facebook, it must be true that people of color are immune or they're less affected to the coronavirus.
Dr. Minor, again, I would say early in this pandemic, when we heard the news of the COVID-19 coronavirus, I could see how people of color could have thought originally that this is something for others. It started in China and then it affected Europe. And in our minds, those people don't look like us. Right. And then when we are listening to the news, the people who are reporting the news, they don't look like us. Right. And America is becoming very excited about it. And oftentimes America doesn't get that excited when people of color are being affected by some negative condition. So I could see where in the early days, we could have thought that. But now we know better. The data is reported every day about how it's affecting us. We are not immune. There's no amount of melanin in our skin that can protect us from the coronavirus. Okay. It's not contagious to our skin. So that dispels that myth. So what we're reading on Facebook and social media about there being conspiracy theories and myths that we're immune, those are all false. And we should really pay attention to the CDC, the World Health Organization, and other reputable organizations that are giving us unbiased news about this deadly virus.
Okay. All right. I guess I got to read this. I really love the section of your op-ed entitled "Love from a Distance." You share John 13:34, "A new command I give you, love one another as I have loved you, so you must love one another." And you go on to write, "We are the church," in big bold letters, church. Although we must practice social distancing, we must continue to practice love. In fact, we practice love by, again in big bold letters, not gathering. So what do you mean when you say social distancing doesn't mean social isolation?
We're the church, and as the church, we're called to love one another and to serve. And we should continue to do that, even though we're socially distancing. So, how can we do that? We can do that by mailing cards to our church members, our others, our neighbors, making telephone calls to check up on people, running errands for people who really should not be out in public, and checking on those people that we know may be socially isolated, those church members who have been sick and shut in prior to COVID-19. Now they have become even more isolated. Those church members who live rurally, they have become even more isolated. So we could do drive-bys. Recently, my church, we drove by, our pastor was on the porch, and we just drove by his house to wave at him and just show him love from a distance. And we do those kind of things for our sick and shut in and our church members who may not be a part of the mainstream.
You have a new definition for drive-by.
Yeah.
All right. Well, is this new normal an opportunity for our youth ministries in our churches?
Oh yeah, absolutely. I hear our young adults lamenting about working at home with those children. So one thing that our youth ministry could do is they could Zoom in. Mm-hmm. So where mom and dad are working, they could Zoom in and do a story time with the children of the church. They could do a show and tell with the children of the church, or some kind of project that engages the child and keeps them away from their working parents for a period of time. I'm sure our young adults would appreciate that.
Exactly. I can see that one. And as a matter of fact, our state convention now, we're having a virtual meeting because of the COVID-19 pandemic. And we have a Zoom just section for our young people each day. We'll give you a heads up on how that's going. All right. So, we got the ability to give online, tithes and offering. It's a lot of wonderful things, but giving still take place. As they say, the light bills still do. Some people have mortgages. They don't stop. And most of our churches are using some online tools for tithes and offering. However, there are some of our folks in the church, some of them are older, some of them even younger. They don't believe in these online sources. They want to come to the church. They want to drop it off or put it in the mail and all those types of things. But do you have any suggestions on how we may get our seasoned saints and others to consider some online methods of giving?
Wow. Online giving is a blessing. However, there are some individuals who simply cannot do online giving. And I don't know right now that we're in this pandemic and socially distanced, if it is the time to address that. But we're going to come together again. And I think, again, that would be an awesome opportunity for our young adult and our youth ministry to do technological training with our seasoned saints, to walk them through this process of online giving and FaceTiming and Zoom, etc. Because I believe that it's going to be a skill set that we are all going to need as we move into our new normal. But for now, as you said, it's important that ministry and the church goes on, and that takes tithes and offering. So for now, we have to go to individuals who are not using technology to receive their tithes and offering. I even know of a church where they are having the members on Sunday, the deacons and trustees stand on the parking lot with the tray, and the members drive by and give their tithes and offering.
Yeah, I've heard that around the country as well.
That's really cool.
Well, I think one thing, Dr. Young, our president, has started the Macedonia Fund. And I know from our state convention, all of us were asked to give $1,000 to go in this fund because some of our churches are struggling. And I would just say to those that are watching and will watch this video, just reach out and let's see how we can make this thing work. But I will say this, sadly, there will be some congregations that will not make it through this time. It's just how it is. And it was the same way back during the Great Depression. It was the same way back in the Great Recession. It's just the nature of things and everything. But we still want to be mindful of the body of Christ, the universal church as a whole. All right. So now let me read another thing of that you've written, this new normal. I like this. I keep saying it over and over again. Okay. But I'm not going to say I hate it. I like it. Okay. And your title is Prepare for Our New Normal. Let's not give up being together, right? We know that from Hebrews 10:25. Although we yearn for normal, let's face it, things will never return to normal. The coronavirus COVID-19 pandemic has redefined our image of church as we know it. Very soon we will gather again. Now, how do we prepare for the new normal in our congregations, and what will new normal worship look like?
Wow. You know, we all love the packed house of God, where we are in there and we are packed together. We are corporately praising the Lord together. But as we move into reopening the church, which I anticipate happening over the next couple of weeks in some places, I think that we have to consider, again, that we don't know who has the virus and who doesn't. So therefore, what I envision is that many pastors have embraced the use of technology during this pandemic. And I can envision that will continue in some ways. But still, we won't completely avoid gathering together. But when we do, I envision that we will have to sit further apart, that's 6 feet apart. I envision that we will wear masks to protect one another from the virus unknowingly. And I just believe that we will be together, but the way that we think of normal worship will change. And not just worship, I envision that occurring for us as individuals and how we interact with one another in our workplaces, really in every setting of where we are.
Okay, and I think that's right. Timely. From our chat feature, it's been noted that we have to be responsible, even though it may not be the politically thing in our churches, but we have to be responsible. I have to be mindful. I know some people say that the Constitution says that don't mess with the church, but there's some responsibility there that we have to do. And I guess, made me think, if we're making the airlines, we go to airlines and people have to put on a mask to get on the plane.
Yeah.
Wow. I guess I have to get used to that. The only issue, I guess, is that for people like us, since you are unfortunately a Cowboy fan and I'm a Steeler fan, we'll have to start wearing these mask stuff and identify who we are. But anyway, I digress, but thought.
No, I like that. I like that. Because we as people of God, we're going to have masks that match our hat and our shoes, and we're going to take.
I had thought about that. Oh wow, a whole new thing. All right. And I guess, and people start making masks, a new cottage industry of making a homemade mask and stuff like that. It should be interesting to see. Okay. All right. Now, look, we have you. We're very fortunate to have you. Because most of the time you have a lot of research. If you don't mind, I do want to ask a couple of questions about our newest initiative that we've been blessed with. Is that okay today?
Oh yes, absolutely.
All right. So we know that you hit our research team, and we've been thankful for you to be a part of us most of the 10 years that we've been active. I never forget the time that we connected. Some pastor told another pastor that we needed somebody to do research, and then other pastor talked to your pastor. There's another pastor, and then I got that number, there's another number, and the long and the short of it, wow, it got connected. And I want y'all to know right now, that's proof positive. Regardless of what people say, we pastors is not lost. When we give us something to do, we will. It may take a little while, so we're busy, but we get it done. And you are proof positive that it does work. So with that being said, our newest initiative is from the National Institutes of Health, and it's called the All of Us Research Program. We know that the genesis of this is in precision medicine. Would you just shed some light on what the precision medicine initiative is all about?
Oh, precision medicine, it's a way that we can treat an individual precisely at the needs of that individual. So whatever treatment that we're prescribing, whatever medication we're prescribing, has that individual's at heart. So it's not one medicine treats all. It's a medicine that treats an individual based on their risk factors, their genetic makeup, et cetera.
All right. Well, then briefly, what is the All of Us Research Program then? It's built in the foundation of precision medicine. So what is the All of Us Research Program?
The All of Us Research Program is a nationwide research study that's funded by the National Institutes of Health. And the goal of the research is to understand what it is that causes a person to get sick and how to help that person stay healthy. And people who join will provide information about their health, their habits, their environment, meaning what is it like where they live, work, and play. And then as the researchers look at those patterns, they're going to learn what factors are affecting a person's health. That will help them in the future develop treatments for that individual.
And I guess down the road, that could even be things like us for African Americans, could be sickle cell. And of course, we're going through right now, this COVID-19. Okay.
Absolutely.
All right. So, well, how would you join? How people would join this, the All of Us program?
People can join by going to the website, allofus.org/together.
Okay. All right. That's simple enough. Well, I gotta go a little bit different. You know, if you got me and I got you, and look, again, I'm so excited to have you to be able to share with us today. Now, it's important for a lot of people to be represented in this study, but why is it especially important for people of color to be represented in this research?
It's important because much of the treatments that we are using today were developed with the white men. And a lot of reasons why that is true is that that's who volunteered to participate. Okay. So it's very important that people of color, especially Blacks, volunteer to participate in All of Us. And in that way, treatments can be made specifically for us, for all of us. And that's one thing that I particularly like about the All of Us program is that it's trying to recruit the number of people that matches the makeup of the United States. So if minorities make up 38% of the United States population, the researchers are trying to make sure that the All of Us has data from that 38% of that data is from minorities in the United States.
Okay. All right. So now let's be honest, you know, when it comes to research in African Americans, we've had some mistakes. It's been some missteps. I think about the Tuskegee situation, Henrietta Lacks. But I guess we learned some lessons, but what lessons have we learned, and what would you say to people who may be skeptical, especially people of color, and get involved in this research? What would you say to them to make them feel more comfortable?
Wow, we can't deny our ugly history regarding minorities and research, but there are processes in place now to avoid that. Prior to conducting any research, we have to go through a very detailed process of getting that study approved, where we describe everything that we're going to do from the time that we interface with the participant, how we recruit them, what's going to happen after we recruit them, what's going to happen as part of the study, what we're going to do with the data after the study. We have to describe all of that before we can even enroll the first person. And the All of Us program is focused on authentically engaging participants in a way that respects their interests, their values, and their personal needs. And we have to make sure that the potential participants of the All of Us program understand that they will be protected as research participants and that no harm will come to them and that their data will be used in a way to help others and not hurt anyone in the process.
All right, excellent. And again, thank you. I'm so glad that we got that done. Again, if people want to join, is allofusresearch.org/together. Wow, we covered a lot of ground today. Whoa. Let me just see if we have anything on our chat function. Again, I guess another question here that for giving, if somebody lives close to someone, they can get their contribution. That's good. Yeah, we can make those connections to people to get that done. Again, if there's anybody on our chat, we apologize for our those watching on Facebook and on YouTube. We're not able to get the questions in real time, but if you do have one, email us at info@hopenbc.com, info@hopenbc.com, and we'll be more happy to respond to you. All right, well, I don't see any question there, but is there anything else, Dr. Williams, that you'd like to add before we conclude today?
Just in general, that we have to make sure as a people that we're protecting ourselves because we're responsible for our individual health. And we can't wait for others to come and help us. That the responsibility is ours, and it's basic things, a lot of it, that our mamas taught us about hand washing and staying away from sick people and being responsible, protecting others by keeping our distance and wearing our mask.
Okay. All right. Again, everybody, for those who are watching, we're thankful, excited today that we're Dr. Lavoro Williams, the head of our research program, the Hope Health Initiative, and a tenure track professor at the University of Kentucky School of Nursing. I know she might not be able to hear, but just where you are, you just give a warm round of applause and thank her so much for persevering. Even when the computer locked up, she found a way to get it done. So thanks again, Dr. Williams, for being so gracious today.
Thank you for the invitation.
All right. Okay, everybody, we're getting ready to wrap things up today. For the more information about COVID-19 and COVID-19 coronavirus information, you can go to our webpage, hopenbc.com. There's a link there for resources available for churches. You also can find the op-ed piece that Dr. Williams completed. We also will have a link. She also had another article she did in the regional paper. We'll have that posted at some point on this afternoon as well. We are preparing a number of webinars, since this is the new normal, a number of webinars for the National Baptist Convention and our health initiative. If you'd like to get an invite so that you have a list of when those things are happening, you can email us at info@hopenbc.com. And we'd be more happy to add to the list and getting those things done. Well, we hope that you found today's webinar helpful. We pray God's blessings for you to have good health, mind, body, and spirit. And on behalf of our president, Dr. Jerry Young, and all of us at the National Baptist Convention USA Incorporated Hope Health Initiative, we wish you a good day and good health. God bless you.